Hello, good day, and welcome to your favorite program, Stopping Medical Tourism. My name is Joseph Kadri, and on today's edition of the program, we shall be looking at one of those urinary tract challenges, call it kidney stone. Well, it's not as simple as it sounds. It causes terrible pains. Some say it's real stone. Some say it's just mineral and salt deposit and makes it difficult for the person to urinate. It affects both male and female. Well, we'll find out how that forms, how it can be treated, and of course, its prevention. And this is the part that we'll always say that you don't need to travel abroad to have it treated. We have it here. Nigerians are doing it. It is done in Abuja. And of course, very many hospitals in Nigeria are taking the lead in terms of treating kidney stones. Well, I have with me your favorite, of course. You want to see him. He's a medical doctor. He's a pastor. He's a philanthropist. Just name it. A very good morning to you, Dr. Christopher Otabor.
Good morning, you're welcome. Thank you. Good morning, viewers.
Yeah, we're going to be looking at kidney stone, and well, it's one of those diseases that is taking the lead when it comes to medical tourism, and we're saying, do we have the capacity to treat it here? I know we have it. But before we go into that, what is kidney stone?
Okay, thank you so much for having me again. Kidney stone is, well, we call it urolithiasis, because when you say kidney stone, you are zeroing in on the kidney. A stone can form and lodge anywhere along the urinary tract, starting from the kidneys to the ureter to the bladder, and even the urethra. That's the passageway for the final passageway for urine. And anywhere along the urinary tract where stone is formed or found, it can present with problems. And the symptoms vary depending on the location and the size of the stone, and also the type of the stone. Yes, a kidney stone is a stone that is formed. It's a solid crystalline material formed of minerals that is found or formed within the urinary tract. Yes, like I've said earlier, the possible locations are starting from the kidney to the ureter to the bladder, and then down to the urethra.
How is the stone formed? Is it that while we eat and drink, maybe some particle we just swallow them, or there are some food that contains stone, and after a while, maybe indigestion can make them can turn them into stone? How?
No, there's a little bit of chemistry in it. You know, when you have a solution, a solution is made up of solid that is dissolved in the solvent, okay? And when the solute reaches a critical concentration, you begin to see the solute itself, okay? For instance, let me give you example with salt and water. If you put salt in water to a certain quantity, it dissolves and you don't see anything. But as you keep adding salt, a point will come when the solution is saturated. Any more salt you put now will be visible as crystals of salt. That's what happens. Certain chemicals, certain solid matters, they dissolve in the system, okay, in the blood and in the urine. But when those when those solutes get to a critical mass in the solution, it begins to crystallize, and then solid materials begin to form. And usually there's a nidus, that's the focal point where it starts. And there are many factors involved: the quantity of the solute, the type of solution of the solvent, the temperature. You know, there are so many factors, and then the anatomy of the urinary tract system also determines whether stone will form or not. So that's how it forms. But I don't think that should bother the patient much as how do you know it's kidney stone and what is the treatment? Okay, and then how it forms. I mean, the predisposing factor, what are the factors? Okay, there are a few symptoms of kidney stones. If anybody has had a stone in the urinary tract before, it's classical. For the ones that are not very obvious, is bleeding from the urinary tract. Yes, some bleeding might be obvious, others might not be. The micro bleeding, the one that you have to put the urine in the microscope to check, and then the laboratory scientists will see blood cells in the urine. That's a signal. That's why it's good to do routine tests. Part of the routine test we do for annual medical check is urinalysis. And urinalysis, your urine may look clear, but under the microscope there will be blood cells in it. Why is the blood there? Because the stone, when it impinges on a certain part of the urinary tract, it can begin to erode that part, and then blood will come out. But because it's mixed with plenty of a large quantity of urine, it will not be obvious to be red. So if we see blood in the urine, we will have to investigate. It's not just that causes blood in the urine.
There are many
other causes like cancer and schistosomiasis. So many things can cause blood in the urine. Then, but for the urine stone that erodes into a blood vessel, it can lead to frank bleeding, such that you see obvious blood in the urine. The urine is turned red, and then that can be a marker. But by and large, the commonest reason why people who have kidney stone come to the hospital is pain. Yes.
Pain on what part of
pain
the body?
In the flanks, very severe pain. You can't miss it. Some people roll on the floor.
When the pain starts?
Yes, when the pain starts. It's very, very difficult to control that pain, especially because the body, the urinary tract is a tube, especially the ureter, even the urethra. Once it impinges on the tube, and the muscles of the ureter is trying to force it down. So that contraction causes the pain, coupled with the local pressure effect of the stone at that junction. There are points along the urinary tract that can suspend the stone and prevent it from passing down. That narrow point can
just to also get this clarification. When somebody is pressed, of course, to pass out urine, and the person, due to some activities, the person delayed the passage of that urine, can it lead to kidney stone? Just
it can predispose to bladder stone, because it can predispose to urinary tract infection. It's always nice to pass urine when you are pressed. Okay, if you don't do it, urine will accumulate. There will be stasis, because almost everything in the body is moving. Movement is life. The urine ought to be cleared as it comes. That's the way not to create a pool, a stagnant pool. Once there's stagnation, bacteria would grow and then can lead to urinary tract infection. So you don't want that. So you just, because UTI urinary tract infection can result from stasis. And if the urine is not moving, there can be a back pressure, and then it can go to the ureters and to the bladder. That can lead to some other problems.
Okay, if I just joined us, the program is Stopping Medical Tourism, and we have, of course, been looking at the causes and prevention, treatment for kidney stone. And Dr. Otabor here, of course, said quite a lot, especially on the symptoms. If you have pain in your flanks, of course, you feel this pain, it comes on, and also when you pass out urine, that's a mixture of urine itself and blood in it. It may just be a sign of kidney stone. Now, the treatment.
Well, let's look at the causes first.
Okay.
Yeah, why should someone have kidney stones or urinary stones? There are many reasons and many postulations, but there are some that are very clear. For instance, in areas of arid regions where there is dryness and the heat is so much, people evaporate water from their skin. The urine quantity is reduced. So the quantity of fluid that is required to flush the kidney system is not available.
It's not.
Yes, because of the arid nature of that area. So it's been found out that people who live in arid region, they have more predisposition to stone because their urine is always concentrated. And so the tendency for crystallization of those salts that are usually deposited in the kidney is higher. So they predispose to stones. Then there are people who also have congenital kidney anomaly.
What does that mean?
Yes, the kidney is supposed to have a certain shape, formed in a certain way, but if the kidney is malformed, it can predispose to kidney stone. Then people who have high level of uric acid in the blood, it predisposed to gout arthritis or other symptoms of gout. So they are predisposed to uric acid stones. Yes. So, and how do you have high level of uric acid in the blood? Uric acid is metabolized from meat. So people who eat excessive meat can have excessive uric acid. And excessive uric acid can predispose to uric acid stones. Yes. Then there are some drugs.
The meat you talk about, is it red meat? Because chicken?
Red meat generally, mostly red meat. But meat that contains protein, meat is protein, and metabolism of protein leads to uric acid formation. So meat generally, but especially red meat. So people who have high uric acid level in their blood, we advise them to avoid red meat. They can take offals. It's better than red meat.
But how do you know that you have uric acid? You have high amount.
Routine tests can pick it up, and then some people can have joint pains. Yes, pains around small joints in the body. Most people who have gout would know because it's a very painful condition that will not go away until it is treated. So people who have gout will know. And those who have gout means increased uric acid in the system that is now causing pain because the uric acid is accumulating in the joints. So if you have that, then watch out for kidney stones. Then there are other things that can predispose to kidney stones. People who take some certain kind of medications. Yes, especially excessive vitamin D consumption. It can lead to accumulation of calcium in the system, and it can accumulate in the kidneys and form stone. Yeah, then there are certain kind of diets too that contains a lot of phytates. They can predispose to kidney stones.
Is spinach part of it?
Yes.
Most time I told them spinach can.
Yes, so spinach should be taken at moderate level, not at excessive level. So these are some of the predispositions to kidney stones.
Yeah, doctor, you've said quite a lot here, and I'm sure that those who have this sign, those who have these symptoms may just be itching to hear the way out, the treatment. Where can they go if, of course, what you're saying is what exactly that they are passing through? Okay,
kidney stone, it is very important that kidney stone is identified on time and treated because it's also one of the causes of chronic kidney disease. I mean, where kidney will fail. Because there are some stones like...
So are you saying it's one of the reasons why we have kidney transplant?
Yes, because there are some stones that are massive and they jam the kidneys, they jam the ureters. And once the urine cannot come out, then the urine accumulates and destroys the kidneys. Yes, for very big stones. Yes.
Our viewers, your calls have been coming in. We'll start picking the calls in 2 minutes. We just want to get this basis before we go.
Okay, so
we'll go into that. Just in 2 minutes, I'll start picking your calls.
Treatment can be conservative. It can be surgical. Conservative treatment, we advise people to take a lot of water so that there will be a lot of urine to flow to flush this renal system. And then we also give painkillers for those who have pain. Sometimes they pass the stones. Some people pass the stones right into the toilets, into the water closet.
Direct from the urinary tract?
Yes, it just keeps coming as long as the water pressure, the hydrostatic pressure keep pushing the stones, the tiny stones. But there are some stones that cannot move because of their staghorn.
So what happened to those kind of stones?
Yes, for those ones, we have to go surgical. There are many ways of taking care of those stones. You can do extracorporeal lithotripsy. That means there's a machine that sends shock waves to the stone to crush it right in the location where it is. After you have done all the tests to identify the location of the stones. That's one. Then two.
That is minimal incision.
No, it's even non-invasive. No surgery, no knife. Yes, you just identify the location and send the waves, and it crushes the stone and it's passed out, depending on the size of the stone. Then there are others that...
That must be expensive.
Yeah, well, not so expensive.
That is the part that...
Then you also do cystoscopy. You can pass a camera through the ureter and pick the stone and bring it out. Yes, either from the bladder, from the ureter, or even from the kidneys. That is done commonly. But worst case scenario for very large stones, you have to open up the kidneys to deliver the stone.
Okay, now let's check the phone lines. Hello, good morning.
Good morning.
Your name and where you calling from? Hello?
I'm calling from Abuja.
Okay, quickly, what's your question or comment?
My question is something that is happening pain that is right side of the waist. Whenever I think it's working her. I don't really know what's the problem all about. I want to know.
Okay, you say you have pain on the left side of your...
Yeah, the right side of the breast.
Okay, breast of the breast.
Okay,
we discussed
you need to visit the hospital for that pain to be properly evaluated. Okay. Yeah, that is very important, and possibly see a general surgeon who would evaluate you properly. You may need to do a mammogram and so on and so forth. Thank you.
Thank you. Thank you. Okay, Doc, we're looking at the treatment, and of course, you say it is not expensive. It can be afforded.
Well, not so expensive. Of course, like you said, this is one of the reasons why people go abroad. But there's good news because from the 18th of August till 25th, Alliance Hospital is welcoming a world-class set of
18th of August to
25th.
That's one whole week.
Yes, they are going to be in town because we thought, okay, where we don't have all the expertise, let's collaborate with people from outside, so that they can come instead of us going.
So for those who have that signs and symptoms,
yes,
or those who
not just for kidney,
diagnosed to
yes,
have it, they can come.
Yeah, not just for kidney, for heart condition, for kidney.
Hello, good morning. Hello? Wow. Okay, we'll go on, doctor.
Yes, so the urologists will be in town and they would be doing highly specialized surgeries for people who have kidney stones, who have other anomalies of the urinary system, and then heart disease. Of course, the second batch of our kidney transplants would be around that time too.
Wow. Hello, good morning.
Good morning, sir.
Your name and where you calling from?
My name is John, calling from Abuja.
Okay, Mr. John, what's your question or comment?
I'm having this pain from my shoulder, my neck, back, my spinal cord.
How old are you?
I'm 30.
30?
Yes, sir.
Wow, quite young. Such pain should be found from 45 and above. Well, you will need to do some investigations to know what's going on. You might be having disc disease in the cervical spine. So you need to see an orthopedic surgeon who would further evaluate.
You need to go to Alliance Hospital, 5 Balloon Close.
Okay.
Yes. we, of course, you were doling out what Alliance has next month from 18 to 25th, and it's really going to be one stop for all kind of.
Even today, there's a camp going on today. It's free consultation.
Oh, really? Hello. Good morning.
Hello. Good morning.
Your name and where you calling from?
Okay, my name is Abdul Malik. I'm calling from Abuja.
Okay. What's your question, Abdul Malik?
Thank you. I was just listening to your program now. The doctor was like saying they are going to be from August 1 week.
Even today, there is today.
Okay, let me explain that. Today, Saturday, and next week, the people are already in town to see patients, discuss with them, investigate them, and then they will plan their surgeries or intervention for 18th to 25th of August. So if you are free, you can even go to Alliance Hospital today, let the doctor see you, evaluate you, and then if you have any such condition, it doesn't even have to be only kidney problem, orthopedic problem, heart disease, and what have you. If you go, you will be seen. Well, registration is 5,000, but consultation is free. And consultation for those big people is supposed to be like 20, 30,000, but it's for free. So once you go, they will evaluate you and advise. Then if you need an intervention, instead of going to India, you can now prepare for 18th of August.
Here in Abuja Alliance. Okay, thank you, Mr. Abdul Malik. Yeah. Wow, that's really going to be a huge one, bringing specialists, urologists to, of course, take a look at the reality of those who have different kinds of problem and to attend to them come 18th to 25th of August in Alliance Hospital. Hello, good morning.
Good morning.
Your name and where are you calling from?
Mohammed Nasser from Apollo State Quarters.
Okay, Mohammed Nasser, your question or comment?
Well, I'm just asking for advice.
Okay.
I go to laboratory and they confirm that I have uric acid 9.2%.
9.2, okay.
Exactly. And also, I'm taking drugs for that. I was prescribed a drug and I'm taking the drug.
Okay.
Please, how can I make sure that the uric acid was reduced from the point it is now? That's my...
Okay, you're already on the right track, sir. First, you should continue with that medication. Secondly, if you were taking too much meat, you have to reduce your quantity of meat. And then people who take red wine, they should stop taking red wine because it also increases the amount of uric acid in the blood. With this, and then with exercise, I'm sure that your uric acid level will be reduced.
Okay. You can also find time to come to Alliance Hospital today. Yes, it's close to you. It's close to Apollo Quarters.
Okay, no problem. Thank you very much.
Thank you.
Thank you. Okay, the time is usually not our friend here, and this is why we are saying someone needs to be part of this. Let's take it up to an hour so that we can have time to bring these things, discuss these things, and of course, give you some kind of free consultation here. Many people have called and we have given them it's consultation, and it's free. Okay, let's take the very last one, my director. Hello, good morning. Quickly, let's hear your comment or question.
Good morning, sir.
Good morning. Your question?
Yeah, my question is, I'm calling from Motherland.
Okay.
My question is, I have a heartburn. I normally, if I eat things, I normally have heartburn.
Yeah.
You understand? And at times, I'll be having a kind of chest, hotness in my chest, in the back and the front at times.
All right.
So how old are you?
I'm 40.
Okay, yes, most likely you have something like an ulcer, but you need to go to the hospital. They will do some tests for you, including what we call H. pylori, Helicobacter pylori. Then you need to go to the hospital. They will do some tests for you, but that will include H. pylori test, H. pylori. Once that test is done, if you have the infection, they will give you treatment for a number of days, and that would stop. Okay?
Okay. Thank you for calling, but I will ask you that you go to Alliance Hospital, number 5, Manufacturing Close, Area 11, Abuja. Okay, this is where we wrap up today's edition of the program, Stopping Medical Tourism. Well, the program gradually is becoming where you call and just get free consultation, but the time will come where we will be charging. Okay, thank you so very much, Dr. Christopher Otabor, for finding time to appear on the program, and we'll come your way again tomorrow at 4:30. It's a repeat, and of course a fresh edition of the program comes same time next week, Saturday. Bye for now.
Independent television.